Come in.
Hi, Aubrey. How are you doing today?
Good, how are you?
Good. I'm Whitney. I'm going to be a nursing student today, and I'm going to do your newborn assessment. Is that okay with you?
Yeah.
Has your baby had a bath yet?
Yes.
Okay, since she's had a bath, I'm allowed to touch her. I'm going to check her ID band. Aubrey, can you tell me your baby's date of birth and name?
Date of birth is January 10th, 2020. Name is Whitney.
Last name?
Dunnick.
Okay. So the first thing I'm going to do, I'm going to listen to everything first in case she starts crying during the assessment. So I have to listen for a full minute. So I'm going to listen for her lung sounds for a full minute. And the normal range is 30 to 60. And her breath sounds were clear. I'm going to listen to her heart now. And her normal heart is 100 to 160. Those are normal. I'm going to listen to her bowel sounds, which are active, and I would listen to all of that for a full minute. Then I would take her temperature, and I would do that under the axillary, and the normal is 97.7 to 99.5, and that's normal. And then her blood pressure would be taken on the monitor. And I'm going to cover her back up. Then I'm going to look at her head. So I'm looking for this. I'm looking at the suture lines, making sure there's no large spaces in between them, no overlapping, making sure the fontanelles are soft and flat, making sure there's no injuries or bruising from birth. Everything looks good there. And then if the baby had caput succedaneum, it would be a generalized swelling of the whole head, and that is fluid. And then if the baby had a cephalhematoma, it would be a collection of blood, and it only be found on one side of the head. It would be more pronounced, and it would cause the baby to be more at risk for jaundice. Okay, then I'm going to take a look at her eyes. I'm going to make sure they are, it's all equal and aligned. So her one eye should be 1/3, her bridge of her nose should be 1/3, and her other eye is 1/3. And it is, there should be no discharge, no bleeding in the eyes, and there is no folds also in her eyes. Then I'm going to take a look at her ears, make sure they are lined up. So I'll go from the inner canthus, outer canthus ear. So it should be all lined up on the same side. Then I'm going to do the fold recoil. So I'm going to fold her ear down on both sides, and in a full-term baby, it would be faster than a preterm baby. Then I'm going to go for the nose. So I'm going to check patency. So I'm going to cover one nose. I'm going to listen and make sure she can breathe out of both. Okay, then I'm going to go to her mouth. So I'm going to put my gloves on. I'm going to stick my finger in, and I'm going to feel for the closure of the soft and hard palates inside of her mouth. And I'm also going to check to see if she has a sucking reflex, and she does. So I'm going to take off my gloves, warm hand hygiene. Then I'm going to go to her neck, and I'm going to use 2 fingers, and I'm going to go from the back to the front, palpate for any masses, so there's no masses. And then I'm also going to check range of motion of the neck and the head. Then I'm going to go to her clavicle. I'm going to make sure, I'm going to do the same thing. So I'm going to go from the back to the front, and I'm going to make sure it's intact. There's no, it's not asymmetrical, and there's no injuries or no swelling. Then I'm going to go to her chest and make sure, look for any signs of respiratory distress. And the 5 signs would be nasal flaring, grunting, retraction, apnea greater than 20 seconds, and seesaw breathing. So seesaw breathing would be when the abdomen falls, the chest rises, and vice versa. Then I would go to the abdomen. I would palpate it. Make sure it's soft and her belly is rounded and non-tender. Then I'm going to go to her umbilical cord. I'm going to make sure there's no signs of infection. I'm going to look for any discharge. If there's crust around it, I'm going to take soap and water and clean it off. I'm going to make sure it's outside of the diaper. And then I'm going to look at her skin. So I'm going to take off her shirt. And I'm looking for any birthmarks, bruises, rashes, hair. I'm also going to make sure her skin is pink, so I'm just going to take a look at all of the arms. I'm going to look at her back, make sure there's the back of her arms, back of her legs, make sure there's no rashes, bruises, or anything. And there's not, so then I'm going to put her shirt back on to keep her warm. And then I'm going to check for signs of jaundice. So I'm going to check first her forehead. And I'm just going to push down, see if it blanches. I'm going to push on her abdomen, then her thigh, and then I'm going to go back up to her sclera and see if there's any yellowing for the jaundice. And then I'm going to check skin turgor. So I'm going to use my forefinger and thumb and pinch her abdomen, and then I can also use her inner thigh to check for skin turgor. Then after I check her skin, I'm going to go inside her diaper. So I'm going to have to put my gloves on, and since I have a female, her assessment would be, I would look at the labia majora and minora, and the labia majora should cover the minora and the post-term baby. And then in a preterm baby, the clitoris and minora would stick out. And then if it was a male, I would have to see if the male had foreskin, and then I would have to check to see if the testes have descended, so I would stick one of my fingers in the inguinal canal, and then I would use my forefinger and thumb to palpate the scrotum, and I would do that on both sides. And then I would have to check the location of the urinary meatus, so that should be at the tip of the penis. And then I would look for rugae, and in a post-term or term baby, there would be deep rugae, and then in a preterm baby there would be none, if any, rugae. After I check her diaper, I'm going to look at her hands and toes, her fingers and toes, so I'm going to make sure there's 5 fingers on both hands, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, make sure there's 5 toes on each foot, 1, 2, 3, 4, 5, 2, 3, 4, 5, then I'm going to look at the creases. For a post-term baby, they should be down 2/3 of the way. And then for a preterm baby, it would be all smooth, there would be no creases. And then on the hands, there should be multiple creases. After I do her hands and feet, I'm going to flip her over to look at her back. So pull this up. Her spine should be straight, there should be no dimples, and there should be no hair tufts at the coccyx, which there's not. So flip her back over, then cover her up, and then I'm going to check her reflexes. So the first one I'm going to check is the Moro reflex. So I would just clap, and then her hands should go up and her fingers should make a C. And then I'm going to check the arm recoil reflex. So I would hold her arm back, hold it forward, and then let go, and her hand should go back into a flex position. And then I would do the Babinski, and so I would start on the pinky side, work my way up, make a J, and her toe should fan out. That would be a normal response. And then that's it for the assessment. And then I would ask the mom questions. When did the baby last have a stool, when did she last void, when was the last time she ate, and when is she due to eat, feed next. And then I would ask the mom if she had any concerns or questions before I left and if she needed anything. And then when I would go I'd document my assessment findings, and then I would document how the baby was, her emotions during my assessment, which would be the baby was content and happy.